Hello, and welcome to the Hawaii Health Data Warehouse's Coffee Break Monthly Webinar Series. I'm Julia Chosey, a public health epidemiologist with the Hawaii Health Data Warehouse, or HHDW. We're going to be talking about the latest youth risk behavior survey data in hhdw.org and hawaiihealthmatters.org. The data from the 2023 survey was just released, and updated health indicators are available on both websites. First, some background. Youth Risk Behavior Surveillance System, or YRBSS, monitors health-related behaviors that contribute to the leading causes of death and disability among youth and young adults. It's actually a system of surveys that includes a national school-based survey and then smaller state, territorial, tribal, and local surveys. YRBSS is maintained by the Centers for Disease Control and Prevention, or CDC, with help from local departments of health and education. It was started in 1990, and Hawaii joined in 93. Our first data was completed after the 2001 administration of the survey. And in Hawaii, the YRBSS is a collaboration between the CDC, the Department of Education, and the Department of Health. So the Youth Risk Behavior Survey, or the YRBS, is the instrument that's used by YRBSS. It's a biennial written or digital survey of public non-charter school students in grades 6 to 12. There's actually two versions of the survey, one for middle school students in grades 6 to 8, and one for high school students in grade 9 to 12. The surveys are similar, but some questions are asked in slightly different ways to make them more reliable and age-appropriate for younger students. For example, while the high school survey may ask about events in the last 12 months or 30 days, the middle school survey may ask about lifetime occurrence. The YRBS uses a two-stage cluster sample design. It is adjusted for non-response and oversampling, and weighting is based on student sex, race, ethnicity, and school grade. So the goal with all of this is to produce a sample that's representative of all public non-charter school students in grades 6 to 12 in Hawaii. The sample is approximately 12,000 students large, about 6,000 each for middle school and high school. So HHDW houses YRBS data from 2001 to 2023. It should be noted that high school data in 2001 and 2003 are not displayed due to an insufficient response rate. In 2011, the sample was expanded, and this allowed for county-level estimates to be calculated. We have county-level data from 2011 on for middle school students and 2013 on for high school students. HHDW also holds the record-level YRBS data, and you can request it with the proper documents. I'll show you where to find these during the demonstration. Some important points to remember about the YRBS and HHDW. The data are stored in the Oracle database, and what we do is we take the raw data and map them to create health indicators that are conformed across years, so a trend can be described. There must be at least 2 years of data for an indicator to be created, and older indicators are retired when a question hasn't been asked in 4 cycles. Data reporting conforms to CDC standards for suppression, and HHDW also provides information on the stability of estimates. There are currently 174 high school and 144 middle school indicators in hhdw.org, and a combination of 101 indicators in Hawaii Health Matters. We created 30 new indicators with the 2023 YRBS data load, and some examples include witnessing violence in the neighborhood, having food allergies, walking or biking to school, receiving additional school services, and usual source for electronic vapor products. Check the data release notes in HHDW to see a complete list. In addition to new indicators, we also created some new dimensions. And when I say dimension, I'm referring to the breakout categories that are available for each indicator. So previously, you could look at an indicator by year, grade, sex, race, ethnicity, and sexual orientation or gender identity. With the 2023 data load, we added 3 new dimensions or breakout groups. So now you can look at indicators by grades in school, current cigarette or electronic vapor product use, and having a parent on active military duty. This expands the way that we can look at the data and provides additional insights into the results. There are some special considerations for the 2023 YRB's data. First of all, the cell suppression criterion changed. Previously, there had to be at least 100 students who answered the question in order to show the estimates. This has been lowered to a requirement of at least 30 students. So what this means is that some estimates that were previously suppressed may now be reportable. And we have updated all of the data on HHDW and Hawaii Health Matters to reflect this new criteria. Since results may be based on smaller sample sizes, it's important to pay attention to the stability of the estimates. And we use the relative standard error to measure stability. And this is the standard error divided by the estimate. An estimate with an RSE less than 3 is considered stable. If the RSE is between 0.3 and 0.5, the estimate is considered unstable. And if the RSE is greater than 0.5, the estimate is considered very unstable and should not be used to inform decision-making. We also updated the display order of the race ethnicity categories on HHDW. Here you can see the new display order for the DOH race ethnicity and the census race ethnicity classifications. Another difference you'll notice is the availability of new sexual identity dimensions. YRBS started asking about sexual identity in 2011 for high school students and 2017 for middle school students. However, beginning in 2021, they changed the question to allow more response options. Because of this, we were unable to trend sexual identity data from 2021 forward with previous years. But now that the new question has been asked for 2 cycles, we have created a new sexual identity dimension for the years 2021 and 2023. So now on hhdw.org, you'll see new options for sexual orientation. These are indicated by the 2021 plus following the variable name. The old sexual identity data is still available for use with data from 2019 or earlier, but now for 21 and 23, we have a new indicator. So we're going to start on the HHDW homepage. And you can see we have a little bit of information about us and some overview videos in case you haven't used the system yet. You can also see we have news and announcements for the new YRBS data. This is where you can register for the coffee break. We have featured content and our latest Instagram posting. But what we're interested in is the actual data. So let's take a look at the YRBS data. This first page that we come to is the landing page for a youth risk behavior survey on HHDW, and it provides a lot of good resources. First of all, there's a little information about the survey, where to get national estimates, and then this table provides the number of students that were surveyed each year, links to the actual survey so you can see the questions, the data release notes, and a data user's guide. I mentioned the data release notes, and I'll show them very quickly. So again, you can see here, this is anything that's new with the 2023 load. So that suppression criteria changed, the race ethnicity order changed, and then here's our list of new indicators. We have quite a few of them, and our new dimensions. So that's a handy resource to have. Below this table is where you'll find our youth risk behavior survey reports. And you can see we do have our 2023 teachers brochures for both high school and middle school. These are a great resource to show you overall how the high school students or middle school students are doing in the state. It's a very convenient resource to use, so find them there. We have older brochures as well and some additional reports. And then below that is where you can request a report. So if you're having trouble finding something, you can send in a request and we'll do our best to help you. And this is also where you can request record level data. So if you click here on this button, this will take you to the page that has all the forms that you need and all the instructions. There's even a video to help you go through the process. So if you're interested in getting record level data for your own analysis, check out this spot here on the landing page. Okay, but all wonderful resources aside, we want to see the data. So what we're going to do is build a custom YRBS report. And you can see here we have some resources that help you navigate the site. There's a content map, and what this does is it shows you all of the indicators available for high school and for middle school. So it gives you a great summary. And then there's also this indicator index, which is a lot of the same information, but in Excel form, so you can sort and filter. And then what you can see here, we have 2 different sections. So this represents the 2 surveys, the high school and middle school. If you click on the triangle, you'll get all of the different categories that are available. So you can see there's a wide range of information that's available. Underneath the categories, some of them will have subcategories. And then when you get through that is when you will see the actual individual indicators. If you hover over this question mark, it will give you the question wording, which is great. And you can see that we have the data available at the state and county level. So let's take a look at one of these and see what we get. This is the default query. So what it does is it provides you with a definition of the indicator that you're looking at, tells you the geography, we're looking at state level data, tells you the years, and by default, it shows you the 3 most recent years of data. So in this case, it's 2019, 21, and 23, and we're looking at the data by year. So here you can see our chart, and you can hover over the bars to get the data, or you can also scroll down to the data table. So here you can see we get the point estimate, we get the upper and lower confidence intervals, we have the count, the average annual estimated population, and a measure of the statistical stability. Below the table is just a way to quickly navigate the site. If you want to look at a different data set or a different health topic, you can do so quickly from here. And below that, we have our technical notes. So this is where you'll find information about the question wording, the suppression, the weighting. We have a suggested citation here. So if you're interested in using any of the data for a report or a paper, you can use this citation. And then additionally, some information about the stability and the fine print. For those of you who are familiar with this website, you'll know that the power really comes in here where you can modify this query. So let's take a look at what this looks like. This is our query builder page, and it looks like a lot of steps, but actually these first 7 steps are filters, so you don't have to do anything with them. They're here if you want to limit your data. So say you are only interested in looking at seniors, you could limit your data here, or only interested in males or females, or a particular race ethnicity. That's how you can narrow down the data to the population that you're really interested in. However, if you want to see the full population, but you'd like to see it broken out by different breakout groups, then you only need to address step number 8. Step number 8 is you telling the system how you want to see the data. So let's take a look at it by race ethnicity. We're going to look at it by year and by race ethnicity. This looks like it gives you quite a bit of information. We can see the distribution of the different race ethnicities for each year. We have all the information in the data table. You'll notice there's some suppressed values. There is an unstable value. And one thing that you can do in that case is aggregate years. So if you pull more years together, your sample size is bigger and you're less likely to have suppression. So what I'm going to do here, instead of looking at it by year and race ethnicity, I'm just going to look at it by race ethnicity. Now what we're going to see is an aggregate of the 3 years, 2019, 21, and 23, and we can look at the rates of depression across race ethnicity for those 3 years. We can see that we still have suppression for American Indian and Alaska Native. We just don't have a big enough sample size. But the rest of them are showing up and they're stable. When you see these 3 little dots here, it means that you can modify the query. So one nice thing you can do in these situations is sort it, and it provides a nice, easy way to see the difference in depression rates by race ethnicity. Now, I mentioned that we have some new dimensions. So let's take a quick look at depression and current cigarette or electronic vapor product use. We also have the grades in school and the military and active duty are the other new dimensions that I mentioned, but we'll take a look at this. So now we are looking at depression by current or current cigarette or electronic vapor product use. And you can see there's quite a difference. Obviously, these confidence intervals do not overlap. So we can see here is the actual data that we're seeing quite a bit of difference. But one thing that's great about this system is you can actually take it a step further and you can look at it by 2 different breakouts. So now we're going to look at it by current cigarette or electronic vapor product use and by sex. And now we can see there's some differences going on by sex as well. So this provides us with some interesting information and allows us to really dig down deep into the data. The data table, again, it can be exported to Excel so that you can do your own data manipulations. This chart you can screenshot if you wanted to use it. You can also print this page or email it if you were wanting to share it. All right, let's take a quick look at the county level data so I can show you what that looks like. Let's move to the middle school students, and we will look at current marijuana use. So we're now going to look at the county level. And this again gives us our definition of the indicator. Again, it's the 3 most recent years of data, and it's showing it to us by county. So here we can see, again, there are some differences. You can see where these confidence intervals do not overlap, which suggests that it's a significant difference. And the data table is here to give you the values. There's also now a map. So this map ranks the 4 different counties based on the prevalence of current marijuana use and shows them in a color scheme where the darkest represents the highest prevalence. So this is an additional feature that you get when you look at the data by county. Let me show you one other trick. One thing you can do if you're interested, say, in looking at how this has changed over time, you can select all of the years. And this time I'm going to look at the data by year and by county. And I'm going to change this to a line bar. You don't have to. You can use whatever kind you like. I feel like with this kind of trend data, it's nice to use the line bar. And here you can see the change in time by county for marijuana use among middle school students. So just another trick. I want to just quickly show you what this data looks like on Hawaii Health Matters. Here is our Hawaii Health Matters homepage. I'm going to go to the community dashboard, which is a great place to start searching your data to see what we have. I'm actually going to do an advanced search, and if you're interested in learning more about that, we have information on the Help Center or the video. The reason I'm doing an advanced search is because I know that it's one way that I can filter the data by data source. So here, I can do youth risk behavior surveillance system. We're going to look at the data grouped by indicator. And what you'll see now is a list of all of the youth risk behavior survey data indicators on Hawaii Health Matters. And it's going to show you the data by state and by county. So you can do a quick, easy comparison. Hawaii Health Matters also tries to offer you some additional context by providing you with these comparison values. So you can see here for intimate partner violence among teens, the point estimate in 2023 was 9.7. And we can learn a little bit more about what that means by seeing that it's lower than the US value, which is good, so it's green. It's higher than the prior value, which is bad, so it's red. But it is trending down, which is green, and it's good. In addition, for the county data, it also provides a comparison to the state level data. If you want just a simple list of all of the YRBS indicators that are available, you can look at this indicator location summary. And now this provides a list of all 101 YRBS indicators that we have available on this site. And you can see they're categorized into different health categories to make it easy to find what you're looking for. And you can see we have quite a few. Let's just take a quick look at one of these so I can show you what all you can see. We'll look at teens who ever tried e-cigarettes. So you can see we have our definition, a little bit of the public health importance. Again, we have our point estimate and our comparison values. And here you can see that there's also a tobacco prevention and control plan target, which we have met. Below these comparison values, you can see the trend data. So you can hover over the chart to get the data values. And then below that is where you'll see the data broken out by subgroups. And the system actually does some statistics for you where you see a red bar is significantly worse than the overall value. And a green bar is significantly better. So you can see pretty quickly those populations at increased risk for e-cigarette use. Here you can also change the data, so you can look at the data by county. And then below this is where we have the related content. Again, this is part of the resource library that Hawaii Health Matters offers. So if there are reports or data resources, fact sheets, anything that's related to teens who ever tried e-cigarettes, you can find it here. It's a great place to look for additional resources. And now I want to give you time for some hands-on work. So take a few minutes to explore the 2023 youth risk behavior data and answer these questions. All right, I will go over the activity answers. So let's see, the first question is, how many high school students participated in the 2023 YRBS? Remember, on HHDW, on that landing page, there was that table that showed the number of students that were surveyed. So in this, the answer to this question is 4,384. The next question is, what percentage of middle school students were current alcohol users in 2023? So now we want to go to the data. We're interested in middle school students, and it's asking about alcohol use. And it wants to know about current alcohol use. So we're going to look at this indicator. And you can see that in 2023, 7.1% of middle school students were current drinkers. The question further asks, how has this changed from 2003? So again, we're going to do that same thing that we did before. We're going to select all of the available data years. And this time, we're also going to look at it by line. So now we can see the trend over time. It's definitely decreasing. In fact, it's significantly lower in 2023 than it was in 2003. You can tell that again because those confidence intervals do not overlap. The last question was for Hawaii Health Matters, and it asked what percentage of high school students drank non-diet soda at least once per day in 2023. So I'm just going to search for soda up here, see if that gives me what I'm looking for. We're looking at teens who drink non-diet soda and pop at least once a day. And we can see that in 2023, 9.9% of high school students drank non-diet soda or pop at least once a day. And then it asks if there's a difference by race, ethnicity. And we can see here that there is one group that stands out. Other Pacific Islanders are more likely to drink non-diet soda or pop at least once a day. So let me get these answers up for you. I want to invite you to join us in January for our next coffee break webinar, which will be talking about the 2023 birth record data in HHDW. If you have any questions, please feel free to contact us at profiles@hhdw. And thank you again for your time. Have a lovely holiday.